Okay. And okay, so we are recording and we are live streaming, and folks are filing in, and attendees are also coming in.
And who knows, the Saints may be marching in.
Well,
Not us.
you followed football last weekend, you know, the Saints marched out.
So I'm going to start because we have a full and exciting agenda tonight. So today we're going to discuss the vaccine distribution process with an emphasis on equity and access, as well as innovative strategies for data collection and reporting, as well as addressing challenges. We have some great, excellent speakers that are joining us. I'm going to start with a couple announcements and also a report. So the first thing I want to do is congratulate and welcome Stephen Brown, who's our new community board chair. This is our first meeting with him as chair, so we welcome and congratulate him. I want to thank Madge for taking minutes tonight, Robert for keeping time, and I want to thank and congratulate Rosa, who will serve as the new technology lead and host of our meetings and oversee the Zoom starting in February. Tonight, Rosa is going to serve as a co-host, and she's also going to be posting links throughout the meeting. So thank you so much, Rosa. I am the HHS representative on the Borough President's Manhattan Vaccine Task Force, which is focused on coordination around technology, seniors, transportation, special populations, and messaging. And so I'm going to share, the first task force meeting was this afternoon, and so I'm going to share some information that was shared at the meeting this afternoon, and in particular focus on some strategies and solutions that were recommended, and also draw from a letter that the Manhattan Borough President wrote on January 14th, where she expressed concerns about the rollout. This is a letter to Mayor de Blasio, and she expressed concerns related to planning, especially for NYCHA, and specific populations, and also concerns about technology and transportation. So the borough president's letter, as well as the Manhattan Vaccine Task Force meeting discussion that happened today, included some information and recommendations that I think are really useful. I'm going to share those, but we're going to learn so much more from our speakers. In terms of information, Rosa is going to be posting links in the chat that people shared during the task force meeting today. So some of the solutions and strategies that came out of both the letter and also the discussion today were as follows. In terms of city management and strategy for the rollout, the Manhattan Borough President, Gail Brewer, recommended that there be a vaccine czar. So a single point person with a staff who can determine the vaccination strategy in each zip code, particularly those hardest hit by COVID. During the discussion today in the meeting, there is a recommendation for there to be more diverse voices and perspectives in management and leadership of the rollout to address the needs of different populations, as well as communication and outreach. There is a need for improved technology and scheduling system, and one that's easy for people to navigate. In particular, a central site for information, a site that's accessible for people with disabilities, and also sites and information that's available in multiple languages and a call center that is a call center with speakers who can speak multiple languages. Right now, there's only English and Spanish available in a city with well over 100 languages. There's also a recommendation for improved community health worker training and improved community outreach. For those who are hesitant to get vaccines, there's a push for culturally tailored messaging and education, as well as credible messengers to answer questions, communicate benefits, and dispel myths and misinformation. There's also a call for accessibility for physical vaccine sites, for those sites to be wheelchair accessible, for there to be accommodations when there are really long, crowded lines. There is a call for there to be vaccine sites in every zip code, and more are needed in Uptown Manhattan. For those who are homebound, mobile units, as well as door-to-door vaccinations. That's something that Councilmember Mark Levine recommended, and he's going to be with us tonight as well. There's also a recommendation for a much more developed plan for NYCHA residents, for homebound seniors, and those in congregate settings, whether group homes, medical facilities, or homeless shelters. Another issue is the need for improved and accessible transportation. And the last kind of need, and this is something that apparently is coming, is for there to be data tracked by age, disability, race, ethnicity, and medical conditions to assess effectiveness as well as fairness and equity. We are so lucky because a team from Convince USA is here, and they're going to share with us their innovative strategies in collecting data about a whole range of issues and outcomes related to the vaccine distribution. Final announcement, tomorrow at 6:30, the borough president will host a Manhattan town hall on COVID-19 with speakers from Black Health, New York City Health and Hospitals, Harlem Hospital, and the Department of Health and Mental Hygiene. So today, as I mentioned, we'll discuss the vaccine distribution process with an emphasis on equity and access, as well as innovative strategies for data collection and reporting, as well as addressing challenges with equity and access. Our panelists include, please let us know if either my name's Catherine DeLazar, if I didn't introduce myself. I am the co-chair of Health and Human Services, along with Sheldon Fine. Please let us know if to the panelists if we mispronounce your name, and we will fix that. So Lorianne Valentin, from the Manhattan Borough Outreach Director from Test and Trace. Corpse, Pauline Ferrante from the Office of External Affairs at the New York City Department of Health and Mental Hygiene, as well as Chelsea Cipriano, the Executive Director of the Office of Legislative Affairs for New York City Department of Health and Mental Hygiene, who's also currently working in the Vaccine Command Center. Scott Ratzan, who's a doctor and also has degrees in public health. You'll have to explain your expertise because I think I'm reading the degrees wrong, Scott. He's the Executive Director from Convince USA at the CUNY Graduate School of Public Health and Health Policy. And Lauren Ra is a program manager of Convince USA and a research coordinator at CUNY School of Public Health and Health Policy. She's not going to be presenting, but she's here to answer questions. We're glad that she's here. And then New York City Council member Mark Levine, the chair of the Health Committee, will be here as well. And please, again, I'm sure that I mispronounced some names, so correct us if we do that. The way that tonight's format and structure is going to work is that the speakers will each take about 15 to 20 minutes to present. After everyone finishes, we'll take questions and response, first from the Health and Human Services Committee, and then from the board, and then from the public. The community members, those from the public, can sign up on a sheet to speak, which we will send out through the chat. So you'll be able to sign up to speak. If you have questions for the speakers, that's great. Please sign up to speak, to ask your questions, because we can't necessarily address questions in the chat or through the Q&A. So if you want to make sure you get an answer, make sure to sign up through the sign up sheet, which will be posted in the chat. Please focus your questions for speakers on the topic of tonight's discussion and in response to what the speakers share. Each member of the public will have a limited amount of time, and that's going to depend on how many people sign up, at which point we'll stop you so that everyone has the chance to speak. We're a community. We're glad to be here together with you. We're glad that everyone's here, both the panelists, community board members, and also members of the public. Please communicate in ways that are respectful and collegial. And please use your legal name in the chat and in the sign-up sheet so that we can call on you accurately. So on that note, thank you again for being here. And I'm going to hand it over to Sheldon Fine, who's going to facilitate the discussion.
Okay, good evening, everybody. I think we have an excellent group of people to present to you. Just to repeat, since the questions and answers will be afterwards, you have some important idea or thought, write it down so you don't forget it, because we value your contribution. We're going to begin with Laureen Valentine, the Manhattan Outreach Director from the Test and Trace Corps. And I was fortunate to have a wonderful discussion. You know, there's very few people working in that Corps, and I think they work 24/7. But I don't know if I'm supposed to say that, but that's how hard they've been working for many, many weeks. So we appreciate your work, and we welcome you to address us now. Laureen.
Hi, good evening, everyone. I did have a small presentation. I was wondering if someone could disable the participation screen sharing so that I could share my screen. My name is Laureen Valentin, and I am the Manhattan Borough Outreach Director for the New York City Health Hospitals Test and Trace Force.
Lorraine, it's Lorraine, isn't it? Do I have that right, Lorraine?
It's Lorraine, yes,
Lorraine,
yes, Lorraine, yes.
Yep. All right, so you should be able to share your screen now. There, you've got it. Okay, very good. I'll shut up.
Got it. Thank you so much, everyone. Okay, so we are gonna go right into this. All right, so these are the current cases and percent positivity rate, the most up-to-date data that we've had so far. And on the bottom here, we'll have the gray portion. A lot of folks, that is new. That is the antigen test, which tells you if you have COVID-19 now. For folks who did do that test, they tested positive for COVID-19. The difference between the antigen and the antibody tells you if you've had COVID prior in 90 days. And this one, if you take it, tells you if you've had COVID-19 now. You'll see the SAT scan with the 7-day percent positivity rate, New York City. We have Staten Island over there with higher than 14% positivity rates in some zones. Brooklyn, Queens, the Bronx, and we're doing just okay in Manhattan compared pretty well actually compared to our other neighboring boroughs, but still severe need to mitigate the virus. And so when we're talking about COVID-19, it's really crucial and important that we highlight the fact that testing was not available to folks in the beginning of the first wave. It wasn't widely available. It was mainly focused and targeted towards essential workers, first responders, folks in nursing homes, you know, as such. And so we started to do, I would say, a big push around testing to make it available and accessible for the public sometime April, May, right? When we started to see the increase in testing. And then from there, when we're talking about testing, we really couldn't tell you as a city until probably end of November that we wanted folks to start getting tested monthly, right? Sometime in October, but in November, when we really made it public that we really need folks to get tested monthly in order for us to understand this unique virus. And so in order to make testing available to folks and make it accessible and make sure that folks are not misinformed about testing, we have some of this data that's available by the Department of Health and Mental Hygiene online. And so the slide deck will be shared with the community board along with takeaways. And so this is a snapshot of COVID-19 in almost 1 year right now in citywide cases. Which includes on the bottom the probable cases, on the left in April, but the cases for sure on the right with the antigen test here. So what do we need to help stop the spread? And so something on here is folks are getting COVID fatigue. We know that. It's not sexy to hear anymore. Wear your mask, wash your hands, stay 6 feet apart, and stay home if you feel sick. But the truth is we know that masks work, right? The topic that folks are most excited about are vaccinations, but we have a supply and demand issue right now in New York City. And so what I'm focused on is non-pharmaceutical intervention. And so one of the points that I actually added up on here for the second point is to partner up with your test and trace outreach to engage the community. And you can do that from anywhere. You can do that from home by being on your phone and talking to the community and, you know, including us in some of these phone conference meetings that folks are having. If folks are not doing virtual presentations or having virtual congregations, right? You can do this if you feel comfortable and are social distance. We do outreach events and we target specific communities and buildings, or we'll just stand at a transportation hub and pass out PPE, which engage folks in a conversation and about testing, and we can ensure that we disseminate any misinformation out there. This is the Manhattan 7-day positivity rate. This is the data that we had as of last week, and I just got the data while tuning into Zoom, so I'll send over the new zip code rates tomorrow, but this is as of last week from the 20th, so it's still pretty recent. The reason why we do all the zip codes is so that you can see what's happening in the city around you. We cross 4 zip codes in a day on average to travel from home to work or to our hospital, you know, for a visit. And so I'm sure Mark is tired of hearing me say that at our COVID-19 updates, but it's really important for us to get to step out of as we've been quarantining, we've had the singular, right, vision. And so to see the broader vision of what COVID-19 looks like around Manhattan from the borough. So you can see here, it doesn't discriminate, doesn't matter where you're at. The positivity rates that you would assume trend in one aspect, you know, trend at another, whether it's the financial district all the way up to Washington Heights. So what does that mean for outreach and test and trace? And so this is a snapshot of January 2021, just a glance. At this point, when the slide was created, we were at 79 events. We've overexceeded that for the month of January. And so I just wanted you to realize that on here, you'll see that this last week, we are focused on emergency immigrant communities, but that doesn't mean that our outreach efforts are only reaching out to those folks. You know, today I did outreach at a coat drive at Union Settlement. We did outreach at Sephora's, which was a restaurant. And so we're kicking off New York Restaurant Week, and we're making sure that our essential workers are safe, but that they also know that they have access to free, safe, reliable testing through New York City Health and Hospitals, and how they can get their hands on that. And so we're making sure that while they're out there supplying and keeping us healthy and fed, that they're maintaining safe, and that they're also able to give out PPE to some of the folks that they're delivering to, along with some outreach material. In regards to the vaccine, and I'm sure Chelsea will jump in a few, but just wanted to highlight a few things. So we're focused on equitable distribution, including acknowledging the history and current experiences of racism and bias in medicine, which is why there's, we say that because there's a lot of vaccine hesitation, right? And so some folks can understand why other folks would be against vaccination right now while we're enduring a global pandemic. And so it's important for us to partner with community, elected, city agency, and sector partners to combat some of that misinformation, but also to disseminate the information within the community. It's really going to take all of us. So the Vaccine Command Center is a New York City interagency effort with the New York City Health Department, Health and Hospitals, Emergency Management, Racial Inclusion and Equity Task Force. And all of these agencies work together to coordinate vaccine distribution in New York City. They're working to execute a comprehensive community engagement and outreach with the emphasis on equity to educate New Yorkers with science-based information and prevent the spread of misinformation. So we know that the federal government has rolled out who is offered the vaccine first. New York State is prioritizing and distributing the schedule. As soon as we have it, we'll continue to do that in New York. So we're waiting to hear more on that. And other prioritized groups have been essential workers who are unable to physically distance people at higher risk of complications for COVID-19 because of age or underlying medical conditions. And so when will vaccines be available to everyone, right? This is what we all want to know. When are we going to do mass distribution of vaccination? And so we at ourselves, and Chelsea will talk about this more once I'm done here, we're waiting for the federal government to be able to hand over the supply that we need in order to continue with the rollout. You know, New York State vaccination has already begun, and she'll have the numbers for you on how many we've been able to distribute since it rolled out, and when we will be able to get it, where we will be able to get it, forgive me. So some of the healthcare providers, community hospital clinics, as we know, urgent care centers, and that they're working additionally to create more vaccine hubs to make it more available for folks. And so in the instance right now, what can we do to help? And it's to continue to practice the 4 core. We're getting to the point where folks are really burdened by spending that dollar for the 3 to 5 masks that you may get at a grocery store or local bodega, right? And so, you know, partnering up with folks like us or other elected officials who may have access to PPE are going to be essential and crucial to make sure that our community stays safe while we're waiting for mass vaccination. And there's on the bottom here for community board leaders, there's a link to request an email for special speakers for any events in the future that you may have. And so I'll stop right there and I'll ask Chelsea if she can step in.
Chelsea, you need to unmute. There you go.
I'm unmuted. Sorry about that. I'm going to ask Pauline from my team to drop in some helpful links that were just shown on the slides about vaccine. I know that there's a lot of frustration about vaccine right now. I think Laureen hit the key points. Number one, I'll just repeat it. We are still very much, you don't, I think the commissioner and others have said this, you don't throw the oars out of the boat just because you see shore. We are still very much in a pandemic, and people are so excited about the vaccine as a light at the end of a very dark tunnel, and we are too. I think the thing that we all need to remember is some parts of New York City right now, luckily not Manhattan, but have percent positivities over 16%, and it's real. And I think that in the excitement of the vaccine, as much as we can remember that we have to keep practicing the core 4 and doing the things that work until we get the vaccine in the supply that we need. That's what's really critical right now. The other thing that we can do while we're waiting on this infrastructure or influx of supply, I'm sorry, we have the infrastructure, need the supply, is really get trusted information out there. We know that for all of the reasons Laureen listed, there is a lot of vaccine hesitancy, and as excited as so many people are about the vaccine, there are a lot of folks who aren't. And addressing hesitancy is multifaceted and challenging and really complicated, but getting trusted information out there and getting community leaders like yourselves to be the trusted voices that people need to hear and see and get that information from, because the government isn't always the best messenger, particularly on this topic, I think is really, really important. So we are here tonight. We will show up to other things if you invite us. We will get you documents, resources. We know the supply lack and infrastructure is frustrating, but it doesn't stop the need to get information out there about why people can trust the vaccine, about safety, and about access. I just want to address a couple of points that were raised at the top of the meeting. I think one is language access on the call line. It's my understanding that the language access line has languages, over 180 languages, I believe, that folks can use on the language line. If that is not the case, or folks are hearing otherwise, I understand when you call it's English and Spanish, but the language line does allow for 180 plus languages. I'm happy to take that back if folks are hearing otherwise. All city websites are translated with the little toggle of the Google Translate at the top. We have heard feedback on that translation service, and I'm taking that back to my team. All documents are translated in 13 plus languages on the health department's website. But if there are places where people are having language access or other accessibility issues, we want to know about them. So I will make sure that you have my email, Pauline's email, Laureen's email. Let us know. Second issue, we are making improvements to the scheduling app for the city hubs. So you'll see that soon. Improvements to the hubs themselves. Obviously, supply is an issue that we personally cannot address, but ensuring that New Yorkers have the right information and access to the vaccine when they are eligible and we have supply is our biggest priority. Data, we are going to publish additional data about race and ethnicity. We hear the calls for that, and we are working to ensure that the data is accurate and able to be shared in a way that makes sense. And then finally, I just want to touch on homebound New Yorkers, because I know that that is a topic of immense passion, importantly, and rightly so. And a lot of you maybe have heard me say in other settings that it is hard. This is not the type of vaccine, at least the two that exist right now, that with emergency use authorization, you can't just throw them in a backpack and show up at someone's door. It's not like testing. They're pretty unstable. They require really significant storage. And so there are challenges with the vaccines themselves of bringing them directly to people. So what we've been trying to do is amplify transportation options. Right now, if you call 877-VAX4-NYC to make an appointment and you say, I'm over 65 and I need transportation help, there are resources in place to do that. It's just rolling out. So more to come on transportation offerings, but we know that homebound is a priority population, and on many people's minds, many of us have homebound folks in our lives who are anxious to get the vaccine. So we are working on it, but the complications of the vaccine make it really, really challenging. So I tried to address what I heard. If there are more questions, I'm here to answer them. We are focused on equity and really trying to ground ourselves in the ever-changing information and the excitement about the vaccine. And we're just grateful for partnership. So yes, hit me with questions. Thank you to Lorraine for the great presentation, and remember the core four. Thank you.
Shelley, you got to unmute.
That was excellent, and we want to thank you for addressing some of the issues that Catherine raised earlier, which is truly very helpful in people's understanding. Okay, we're going to move on now. We mentioned convince earlier. Dr. Scott Ratson is here, and I know that he has Pauline, right? Pauline Ferrante with him, correct?
Lauren Rao with me.
Excuse me, Laura Rao. And I think that you'll find this very interesting because Convince USA is connected with a larger global movement, and it's one of the few global initiatives that it seems that the United States has been isolated doing its own thing. But the work of this group is extraordinary, and we wish you'll give close attention to what they do and some specifics that are developing right now. So Dr. Ratson, please proceed.
Well, thank you, Sheldon, for the intro, and Catherine earlier of setting all this up. It's actually very impressive, Chelsea, to hear your enthusiasm and all the great work that seems to be put in place, and Lorian explaining what the city's doing. We've been engaged in this global initiative, first called CONVINCE, which is an acronym for COVID New Vaccine Information, Communication, and Engagement. And whilst we started this at CUNY in our global discussion and launched this at the United Nations with a global event during July, we nonetheless have this now based at the City University of New York, the public school of public health here. And just to mention in my transparency, I've been also on the faculty at Columbia for some time teaching health communication, which is my area. And just before joining CUNY, I spent the last year as a senior fellow at Harvard Kennedy School, where I was in the Center for Business and Government, also looking at the multi-sectoral engagement. So I'm going to spend about 15 minutes and go through some of the slides of what we've been doing. Some of it is very, very local, and then some of it, of course, ties into the global area. But I'm going to start, and some of these slides, I should say, I presented this to the U.S. Health and Human Services Committee. They have a National Vaccine Advisory Committee that met in January. So some of these slides have just been there as well. But when COVID hit, while we're here at CUNY, I lead a program in health communication for social change. We very quickly wrote with others, what do we need to do? And we all know what we need to do. Chelsea and others have mentioned it, right? We need to have a clear source, trusted information that is consistent, that we have, whether it's at the federal level or even the local level. So we called for this in March. The National Academy of Medicine published it. It was with other people on the Board of Global Health that I serve on at the academies. Larry Gostin is an expert at Georgetown Law School, and Ruth Parker at Emory. And we called for something that was very clear, and still we're republishing this article. The reason it has a 5 there, it was the top 5 article that was read by the academies this year. And yet reading it, though, as we know, has not translated into action. So as you see, the bolded part, we suggest.
Sorry to interrupt. Your slides aren't advancing.
Oh, they're not advancing. Oof. Okay. Thank you for telling me that. Wonder why.
You need to go to under view.
Okay.
If you go to under view and then do the slide presentation or the full screen view, I think that will, then you can use your up and down key.
That's what I thought I had, but evidently it's disappeared. Okay, now I got to find it. Okay. Is it shared now?
Not yet.
Let's try one more time.
It was shared before.
How is it now?
Was it?
Oh.
Now you're on.
Okay.
Yeah.
So do you see this? Do you see the slide with when COVID hit?
Mm-hmm.
Okay. So I was referring to this as a very strong piece of calling for a Surgeon General or someone, as I'm now showing, to be tasked to create a public-private interdisciplinary news bureau. So with this in mind, and let's see if it's still advancing, we've called for this, and we've continued to try to focus to build a credible source here in New York. So is the next slide showing our survey? No.
No. See where your mouse was hovering?
Okay.
I think you need to click that.
Go back. Yeah, you just have to click each time on the next slide, unless you go into slideshow view.
Okay. I'm gonna stay out of the slideshow view because this is embarrassing, right?
You're doing fine.
Okay, so here we are. So you can see that we began the social research at the epicenter, right?
Yes.
So we spoke nationally on what needs to be done, and then on March 13th, with the support of the dean and others, we began a public opinion survey. So we now have week on week since March, and then we went to a phase of a panel of participants in New York City. We also ran this in New York State to try to measure perceptions, attitudes, knowledge, behaviors, and trending issues. I think we had the only data at one point of how many people were getting tested or knew of someone who got tested or knew of someone in their household who was sick. But it was a public opinion survey. It's not epidemiology, but it was also showing the issues with food security or food insecurity, with people worried about eviction, with people's unemployment and so forth. And we've been tracking this for some time. And now the next survey that we have right now is very specific to vaccination. And we've been asking, in September before the election, do you agree or disagree with the following statement? When a vaccine for COVID-19 becomes available, I will get it. And as you see, a good percentage of the population early on at this point were not willing to get the vaccine. And this followed other data that Chelsea mentioned earlier, that vaccine hesitancy is real. And we've been trying to see, okay, will this change after the election? And as you see, it's a little bit stronger that after the election, we're now to about 67% of the people in November said, based on the results, they're likely to get a COVID vaccine once it's available. And even having said that, when we looked at the data closely, the African-American community and others are very low, which is consistent with national data in the 30% range. And we also found that the very young and the old are interested, but those in the 30 to 49 age group haven't been getting flu shots, aren't as normalized to getting vaccines. So there's also some challenge there, and that was highlighted in the New York Times piece. We have the third survey that's being on the same group of 1,000 New Yorkers that will be fielded this weekend. So we'll have some fresh data we can share with you next week. And these are the other surveys that we're doing. So we're not just doing surveys that are, shall we say, quantitative. We're also doing this in a way where we have open-ended questions looking very specific at Harlem, where that's where we're based, 125th Street. But also we have a whole Harlem Health Initiative and other areas that we're trying to look and understand the challenges and the barriers. And then we're actually doing a national survey by taking the top 4 metropolitan areas of Dallas, Fort Worth, New York, Chicago, and LA, and see if there's some other things that we can cull from this that would also help both urban and other environments as we're working globally. What we do is we field the survey over a weekend, a Friday, Saturday, Sunday. We have the results generally reviewed by our academic team on Monday, and Lauren is the leader of that, and I thank her also for coaching me on my slides. But she's really the expert on all, and we have a whole bank of survey data already. But we also have this national initiative, and we've been fortunate the Commonwealth Fund has supported us to look at qualitative research. So we're bringing some of the top thinkers and communities. How do we build trust in health services and vaccination? So we know that this is not just a one-shot, no pun intended, deal. It's, we know it's 2 shots, but even more so, we need to build trust in services where people need to go. So we had the first expert roundtable. We're fortunate to have Helene Gale, who chaired the National Academy's work on prioritizing the levels from 1A, 1B, and so forth, who is engaged. We had the National Academies, we had Kaiser Family Foundation, and then we have a number of experts that are part of our Commonwealth Fund work. And we just share the top line with this, that we believe there's consensus to really have communication strategies that are focused on key messengers, and these need to change. They're not static. It's not who's the messenger today is the right one for tomorrow. And yet we need to build those trustworthy folks and help them have the right messages. Develop technologies as an information source. I am a big mobile health guy. I believe that this should be arm's length away of positive messages, but we know that people text while walking across the street that causes injuries. We also know that this can get in the way, but this is also an opportunity. So how do we use those technologies? Collaborate to reframe the issue. Our people have suggested this is like a political campaign. You know, we put a sticker on when we vote. We should have a sticker on when we're vaccinated. And what are other ways that we could have? This is the right thing to do for your community. And frankly, we're also finding when we look at the data, some communities, that message is much stronger. I need to do it not for myself, but for my friends, my family, my community, that are more important than I need to do it for myself to protect from getting sick. So these are the kind of messages we're teasing out. How do we develop these vaccine confidence communication strategies to build trust and to promote it for the key groups that we've identified: healthcare workers, faith leaders, and employers? And let me mention that we have one of the world's experts who's an anthropologist, who's an American based at the London School Vaccine Confidence Project, Heidi Larson. You may have seen her. She was on a New York Times, one of the Deal book focus with Bill Gates, reminding that these rumors stick. Her book is called Stuck. And we're trying to unstick the rumors. And the CDC Foundation has helped support us, that we take the messages that are not just in New York, but throughout the United States. And the Community Health Acceleration Partnership is a global initiative, so we could take those messages from New York to other parts of the world. We also have engaged the business sector. And one of the areas that I'm engaged with is the group called Business Partners to Convince. And this is based with the U.S. Council for International Business. And I just highlight, we've written 2 articles, one with the Harvard Business Review, Why Businesses Are Important, in August. And just in December, I wrote something in the Financial Times also on this issue, that one of the studies that we've also done, is beyond the scope of the time here, but at CUNY, you know, we have, again, a local university, but we did a study of 19 countries, 13,000 respondents of what they think about vaccination, government response to COVID. We've published that in Nature Medicine and others, and continue to get people on a daily basis, not only just media around the world, but really interested in what the study shows. And we do show gender is just like the microbe doesn't respect borders, how people behave doesn't always respect borders as well. So we're learning a lot from that, and that's also informing our activities. And Business Partners is working, which is what I'm going to show, as I was fortunate to share with Sheldon and Catherine yesterday, that the Business Partners to Convince are working on a challenge. And this is a challenge that I believe could work if workplace is engaged in thinking about this as a very important catchment area, to use a sort of a public health term. The people that work also have families, also are part of our communities. So how can we get employers to engage? And this could be employers from public employers, and we've spoken to the MTA who's contacted us, and others, that we believe that, you know, businesses will sign on to this. How do I, and they're very clear, our organization will accept the challenge to address our employees' needs and concerns about the prevention of COVID-19 and the need to vaccinate against it. I will protect my family, myself, my community, my workplace, and my customers by following the latest public health guidance. And here we, of course, defer to the city or the area that the businesses are part of. 3, promote the best available scientific evidence and guidance on vaccine benefits, risk, and acceptance. And how do you promote that in a way that people understand it? And we're working of a term we'll see later, we call vaccine literacy, that's important here. But how do we promote that? Next, encourage the confidence and uptake, which means challenging vaccine misinformation, encouraging and building employee vaccine literacy, so people get this at work or get this via their workplace. Actively advocate for accessible, equitable, and timely vaccination of employees and their families. That should be, you know, obviously something that I believe we all stand for, as Chelsea well represented the equity standpoint, which is also part of our mission at CUNY. And of course, this is we can't do anything alone. We all need to partner. Businesses need to partner with communities, schools, faith-based organizations, public health leaders, political folks, as all of you, to really help stop the spread. So this is how we framed it. We say it's subject to organizational approval. It's very close to something we like to go live with. That could be a number of groups can sign on. I have worked on one of these in the past that included Health and Human Services of the U.S. government, with American Cancer Society, Mayo Clinic. I skipped over, I worked at Johnson & Johnson for 11 years, and we were the employer side of this, at least from the private sector, but again, the US government had signed up at that point. And then this is the framing, and I'm almost done, so I have to give a little bit of an academic push here that, vaccine literacy is a new framing, and it's something that we have identified, and Lauren deserves credit for doing a full bibliography of all the strategies that have been done to build vaccine literacy, and why this will be the next anchor or flag in the ground will help us not only get out of COVID pandemic, but prevent us against future pandemics. And we think vaccine literacy, and this builds on the federal government has health literacy in the Affordable Care Act. Almost every state has a similar kind of piece, and it's part of this broader healthy people movement. But vaccine literacy occurs when we have skills and abilities of people, so we give them the education and the background and the materials, with the content, processes, and systems, which is governmental, public health systems, health and hospitals, all the groups that are part of the healthcare delivery system. And giving people the knowledge so they know why a vaccine works, that it's not once you get sick, it doesn't supplant what we heard about masks and other pieces. So very simple. And we think these are the principles that are the right ones. And without spending too much time to mention that we can share this whole presentation with you, of course. It's knowledge. We think people can sign on to these principles. And I have it referenced that Ruth Parker and I have written this definition. We wrote the definition for health literacy that was adopted in the Affordable Care Act 20 years ago, and now we think this is the new framing of what we ought to be doing today. So this is the final slide, or before my thank you slide. So my penultimate slide, potential action steps. We are interested in doing demonstration projects with Convince. We have research. We'll share our research. It's open data that we'll, with the appropriate, we have all of the privacy and other issues, but how do we help to advance equitable access? And that's what we like to do. Two, we think that there's an opportunity to have a vaccine information bureau. People might say, go to the CDC site. Well, or go to the state or the city. They're all different. Maybe we need one that puts this in ways that people can understand with salient, culturally competent communication, and update on messages. The messages will change, and it can even be more complex. If this third vaccine comes out, that's a single dose vaccine, and it has lower efficacy or different efficacy, we need some non-branded information. 3, vaccine literacy toolkits. We've been working with Salesforce. Salesforce just signed a big deal I read today with state of California and some other cities, but we're working with them on what are vaccine, for planners, toolkits, and so forth. But even more specific, what would be one that might work here? And I say here as local as you like to make it. It's great to see the dashboard, the slide with the zip codes. We're working on a dashboard to also make it simple, where you can go on our website and find out exactly where the differences might be, not just on the epidemiology or where people are tested positive, but where the messages might be working or where the vaccine uptake is or is not, in a way also that makes it from a checkerboard into the colors that we want if we do a color-coded piece. The challenge, I just mentioned what that could be. That challenge, I'm saying it's coming from the business side, but we're all at a workplace in one way or another, proverbially. And then finally, vaccine literal principles. Do we have the right ones? Are these the ones that are endorsable, or are there ways that we can build upon it? And I'll just go to my final thank you slide that, as mentioned, Lauren is our program manager and a research associate amongst all these. We have a couple of others that are both professors and academic researchers and seasoned public affairs people. I say that they all have a different place in our core team. I edit the Journal of Health Communication, as I mentioned, and have a advisory board or an editorial board of 50 plus people. But amongst that, I even went broader. Jonathan Fielding, who used to chair the Clinical Preventative Task Force, is giving some good advice and supported or is the namesake of the UCLA Fielding School of Public Health. Bill Novelli is known for Business for Impact and started the Campaign for Tobacco-Free Kids. Molly Brody will be doing a big push tomorrow on the Kaiser Family Foundation survey that again shows some new data on vaccine confidence or hesitancy, which is both promising and troubling, depending on how you look at it. Helene Gale, as I mentioned before, who's one of the global and national leaders in the space. Larry Gostin, Peggy Hamburg, I think all of you know from not only her New York days, but FDA and so forth. And David Navarro is the special envoy. We've been fortunate that people are, we all are in this together, if I can say to all of you. We do think global, but we act locally. We are here, as part of the city. We have a wide array of students. I'm very proud to be, working with them, notwithstanding Lauren's great work, but we have mid-career students. We have practicing physicians. We have many others who are interested in the health communication for social change and embracing this. We can start to add them to our core team, Lauren. We have a number of research assistants that are part of this and are eager to work with you. So, I'm going to stop. Thanks for the opportunity today. We'll have a final publication that's coming out in a couple of weeks. It says January. It'll be out in the next 2 weeks. But you can see these are research studies that are not just from us at CUNY, but some of the top people around the United States. And we hope to be able to shed light of what we can help here in the city, the borough, as you like in District 7. So I'll turn it back over to you, Sheldon, and thanks for the opportunity today.
Shelley, you got to unmute yourself.
I guess I get a second chance every time. Okay. First, thank you so much, Dr. Ratson and Laura. Your work is extraordinary and valuable for our purposes, and it needs to be supported as the work of the test and trace by the city and local officials. And one of our goals in our resolution is going to be to urge their attention to the work you're doing. One, to support it, because with the support of the electeds, it's more likely to be get the cooperation of private and public organizations, but also the need for them to understand what you're trying to do and the results you're finding, so they can inform their work and hopefully the better work of the city, especially in vaccine distribution. So we thank you very, very much. Is Mark Levine here yet?
I don't see him.
Okay.
If I could just intervene to say two things briefly. One, I encourage people in the community to sign up to speak. We really want to hear your questions and answer them. So we encourage you to sign up. The sign up list is posted in the chat. And then I also wanted to ask if Pauline, if you have anything that you want to add. I don't think you spoke, so just wanted to ask if you had anything to add.
Thanks so much. So I am the Manhattan coordinator for our Office of External Affairs. So I work very closely with all the community boards in Manhattan. So if there are any specific concerns related to Community Board 7, just please email me. You have my contact information. I'm more than happy to be able to be your liaison between you and the Department of Health.
Great. Thank you. Thank you. Okay. So if Mark isn't here yet, maybe we should begin with some questions and take a break when he signs on. Yes.
Shelley, Eric Cuello is with us. He's Mark's right-hand person for a lot of our stuff. Shall I unmute him to make sure that to see if he knows when Mark expects to join us?
Sure. I'm sure he knows. Great.
Eric, can you hear us, and can you let us know an ETA or how we should approach?
Hey everybody, happy to be here. So I just pinged Mark, and as soon as I have an update, I will let you know.
Okay.
Great. You can email that to me, and then I'll make sure that the chairs know.
Absolutely.
Thanks.
Okay, super. So we're going to begin entertaining questions from the committee members. And then we're going to go to other community board members and then to the public. So if I can recognize any hands. I see Robert, and then I also see Courtney, and I see Richard Robbins. Okay, am I missing anybody?
Rosa.
Rosa.
Okay, Rosa.
And
So-
Madge.
And Madge also, great. So let's proceed. Robert, why don't you begin?
Right, in the first presentation where you had the chart showing the rate by zip code, 0034 Washington Heights up there, it just seemed particularly high. I think it has something as high as 12 or 14%. Now, I know the area, and I know how dense it is, but is there anything we should know about that particular community that would account for this spike? It's not a spike, it's been that way.
And Laureen, I'll let you answer this, but I just want to chime in that I am dropping the link to all of the health department's data on percent positivity. And what you'll see is what was in the presentation were screenshots. I just dropped it in the chat just now. But what you see in there is screenshots in the presentation. In the actual map, you can scroll over each community, over each zip code, and kind of hover and see all of the percent positivity detail and what's going on. You can also click through into the additional tabs and see the growth over time. So you can kind of see where in particular things started getting pretty bad again in the fall. I'll let Laureen speak to what they're seeing in the tracing data and other things, but I think, you know, unfortunately we're seeing a lot of, and I can't speak to this community in particular, but we're seeing a lot of exhaustion. People are tired of doing this and they want to get back to their normal lives. And that means more casual interactions inside, right? Like inviting people over for dinner, even with just a couple of people. And that's to no one's fault. This has been a really long year. And I think we're all like kind of anxious for that human contact. So Laureen, I want to defer to you on what you're seeing in the tracing data, but I think what we're seeing citywide is just, you know, we know where COVID spreads indoors more than not. Unmasked activity where you're projecting or yelling or singing, and when you're not able to maintain those 6 feet of distance. And unfortunately, we're beyond the point of, you know, maybe 6 months ago where the spikes were really in those big events, right? Like a big wedding or a big indoor gathering. And now it's just kind of routine inter-household behavior. So Laureen, I'll defer to you, but I wanted to draw folks' attention to that data because thanks for that great question.
So that it's essentially, let's call it the human error factor. So it's human behavior. It's not an environmental, it's not the density of the housing, because of course up and down.
Robert, I would say that you hit it right there on the nail. It is, you know, in New York City, we know that we are very compact. And so if our folks have to go out and they have to go to work, they have to go to their appointments, you know, they're passing by their neighbors' doors, you know, they're going down the stairs, they're in the elevators together. And as Chelsea said, we are seeing a lot of the positivity rates increase in most communities because folks are doing social gatherings. They're not wearing their masks even when they're indoors. And so there's another level of education in our outreach world where we're telling folks to please wear your mask indoors. And when folks are testing positive and they're living in multi-generational homes and they're choosing not to use some of our hotel services, they're also neglecting to wear their mask at home to protect themselves and their loved ones. So there's a few levels of non-pharmaceutical intervention education that we're trying to do here. But yeah, it has to do with the density issue in New York City and how tight we are right now.
I wonder, Dr. Ratson, that's the Presby community. And I know that the community medicine service at Presbyterian is aggressive. They all are, Sinai, Montefiore, all of them. But yet we have these exaggerated numbers right in the middle of one of the most important medical centers, teaching facilities, and all of that. They're right up there, 34 and 40 and so on. Do you have any insight into that, sir?
Well, I mean, it's a good question that we can't just look at demographics or where people are and be able to draw conclusions that we found. And as we continue to look horizontally amongst people that we're surveying in New York, as well as in other parts of the country and amongst various age groups and other parts of the state, we have found that people have some of the connectivity that's more to their own social or community network than necessarily oftentimes where they geographically live, or even their catchment with a hospital or healthcare system or care practice or whatever it might be. So the short is I don't have a simple answer, but we do have the ability to try to unpack it and come up with some correlations that might be helpful as we're designing a campaign. Right now, we've done a lot of tracking, and a lot of our work has been covered in the news from a public affairs or getting hopefully policymakers to help make informed decisions. But now we want to actually use this to help get people vaccinated and stay vaccinated and practice appropriate measures.
Thank you.
Thank you. Courtney.
Yeah. First of all, thank you. This was fantastic and just really important work. One other question about kind of that convince data, which I just stunning, wonderful, important. Two questions for you. In kind of looking at those two data sets about the numbers who were expecting to that shift between those who were expressing some concern or lack of intent to the numbers that we saw in December. Do you have any sense of either messages that were driving that shift or channels that might be correlated with some of that impact? I just think for our own uses, but and we're taught when we start talking to elected officials, the importance of understanding those two, I think would be really helpful. And in addition, I was also really happy to see your take on the influencers and having those iterate as well, because obviously that's an important way of getting the message out.
Sure. No, I mean, thanks, Courtney. And I think it's a really excellent question that we try to ascertain early on where people were getting their information. Because I started on the whole trusted source, and I thought people, they're going to get it from social media. They're going to get, but New Yorkers were not getting it from social media across the board. They were getting it from television and radio. And then we even tested where they get it more from the governor, the mayor, the federal government. And we found, frankly, it was still TV, and then the governor, continued to be a little bit higher, and certainly higher than the federal government. And yet, then we later looked at Fauci and others were coming in. Our hypothesis, and I told it to the Times, although they separated out the age group they were looking at there, that I believe there was so much, distrust, disinformation, whatever you want to call it, that was coming from not only the task force that was dismantled, and then you had, Scott Atlas and a variety of others, problems that people didn't want to trust government and started going down. So that's why we asked before the election, after the election, and we'll really know more this weekend or early next week. But our hypothesis is, yes, definitely this extra optimism, the fact that we have a government that is focusing on this with seriousness. And even after the election, Biden did put a task force up that had trusted leadership. So we're thinking that will trickle down, that people will have more trust in the system. Our whole Commonwealth project is about trust. And unfortunately, the CDC had lost more than any federal agency during this pandemic, when they should have been the lead public health agency. And it's going to take some time to rebuild all of that back, and it might have to be rebuilt back on a local and city and state level first before it ends up coming back down from, if I can say down from the federal level. I mean, I'm frankly, personally, I'm just shocked. I mean, you can read everything from the Wall Street Journal's editorial yesterday, that federalism works, and we have this all amalgam of policies for vaccination. And then of course, others are saying, no, we need a strong federal policy so we could get vaccines, because it's a supply issue now, as governors are saying now as well. So I don't know if I answered it correctly, but I'm very hopeful that we're on the right track now. And the fact that we're having these discussions, and I've been quite impressed by the level of discourse that the city has been putting forward. I'll put in the chat, at least that Chelsea shared and Lorian earlier. I'll put in the chat. We have 12 weeks of some surveys that are basically just press releases. But we also, if you want any more in our particular areas, we can share it with you.
That'd be great. Thank you.
Rosa?
I just had a few quick comments. One, Laureen mentioned just now, which is that in families of color, people tend to live in multi-generational households. So I think keeping that in mind is really important. There was also, I think vaccine literacy is especially important, and that should be provided definitely in multilingual versions, but at all accessible to all. So a lot of times what I see is information that maybe the average person can't grasp. So having that be accessible to everyone. And then I'm part of a group in Harlem called the Harlem Wellness Group. And I was on a meditation session this morning, and the vaccine came up, and it's a bunch of older women of color. And they were talking about the vaccine, and they mentioned that they were really excited about Dr. Kizzy's involvement with the Moderna vaccine. And I thought that was really interesting that these older women of color were really specifically talking about this and how they were excited and waiting for that. So that's something that has to be kept in mind, I think, as you think about communities of color, that if there is an issue of trust, then that's something that you have to speak to. I heard this, I mean, this isn't, of course, it wasn't researched, but I just dropped in and heard this, and there were at least 5 older women who were specifically talking about waiting for Dr. Kizzy's Moderna vaccine. So just wanted to drop that information. Thanks.
If I do you mind if I respond to that? Because you said that excitedly. I am a big Dr. Corbett fan. I think I want to make like Kizzy paraphernalia. So she's awesome. I think that amplifying the fact that a Black woman had a role in developing these vaccines is just so important and compelling, and like giving credit where credit is due. I think it will really help with trust, as you were saying. And so anyway, I didn't do it this time, and I should have. I've really been trying to work it into my remarks because I think it's critical. Everyone knows Dr. Fauci. It's time for everyone to know Dr. Corbett. I think that the other thing that you said in terms of the group that you were talking with, we're trying to have these several different approaches. There's the presentation that Laureen gave tonight. We have a longer presentation that's kind of like a deep dive vaccine 101. And then there's these train the trainer models that we're using, where basically I know that I'm not the best messenger for this, for a lot of populations. And we have folks from obviously all ethnicities and backgrounds and communities from all over New York City going out there doing the presentations. But the most important voices are those from the community. And so we're doing Train the Trainer. We have a couple of, I'll make sure that Pauline has the information so that you all can disseminate it to your groups. I think they're happening on Thursdays, like pretty much every week right now, and we have signups. And then we're also doing community conversations, which essentially is a really just laid back Q&A to try to address hesitancy. And so trying a couple of different formats, acknowledging that one size is not going to fit all here, and it really needs to be catered for the population and their different concerns. So anyway, I just want to thank you for raising those 2 very important points. And I'm happy to get more information on either of those things to whomever wants it, because we definitely want maximum buy-in.
Okay, great. Madge and then Rich.
Before we go to Madge, Councilmember Mark Levine is here. So why don't we hand it over to him, and then we can go back to questions and answers. Welcome, Councilmember Mark
Thank
Levine.
you, Catherine, and hello, everybody. This is just one of the most active committees on health. CB7 has one of the best health committees of any board that I know. So thank you for your leadership on this. And wonderful to see my friends from the health department. Hey, Chelsea. We're lucky to have them on with us. I gather that you have spent some time tonight talking about the challenges that we face, inequity and the complexity. So maybe I'll just spend a minute or two on what I think the solutions are, in case you haven't talked about that when it comes to supply, when it comes to registration, when it comes to who's eligible, and more. And I'll start with supply because really that is the challenge with trumps all else. And our supply has dwindled to an alarming level, down to just 7,700 this morning, first shot for the whole city. It's really astounding. More shipments have been coming tonight, and into tomorrow, but we're still only getting about 100,000 a week, which for a city of this size with 2.5 million people eligible is a paltry sum, and it would take till somewhere in 2022 to get to herd immunity. We need the federal government to up the pace. We need the federal government to apply the Defense Production Act to fix some of the supply chain problems. And we need them to use a fairer formula. New York City gets vaccine based, or every place in the country gets vaccine based on population. Well, here in New York City, we are vaccinating a ton of people who don't live in the city, tens of thousands of people. And that's okay, we should. Many of them are essential workers here, and we definitely want to vaccinate them. Many are not. Many are people who have come here from all over the region, upstate, etc., Long Island, Jersey, PA, because they just got an appointment on one of the scheduling systems. And that's fine, but we don't get one more dose to compensate for that. So currently, about 28% of the vaccinations in the city are going to people who don't live here. And that comes out of our already fairly meager supply. That's something that needs to be fixed. We need to have 400,000 doses that we can deliver to people who live in this city every week if we're going to get to herd immunity by the middle of this year. And that should be our plan. But we can't ignore the challenges in registration that even were hellish in the first weeks when we had more supply than we were using. And I think the root of the problem is an incredibly fractured healthcare system that has led to dozens of different ways to register. And unless you are someone who's got hours of time on your hands, technological knowledge, English ability, a good internet connection, etc., it doesn't work. We need something like what travel websites have developed, which is they take hundreds of disparate airline systems and they bring it together seamlessly in one web page that doesn't require a lot of technical expertise to manage. And we can do this. The city can do this. In fact, there are some enterprising volunteers, young techies, who've built this site, which maybe Eric, who's on my team, could drop the link in the chat. If not, when I have a break, I'll put it in. But some young techies have built a site which basically crawls through most of the scheduling systems and tells you where, if any, appointments are available, which is great. It's it's very helpful, but rudimentary. And it proves that the city could do this and should do this. It's a reflection of what's possible. I am extremely concerned that the result of the difficulty in getting a vaccine has been to crowd out people who are vulnerable. Seniors, who it appears anecdotally are actually underrepresented amongst those who are getting vaccinated. I believe they represent about 40% of those who are eligible, but only about 30% of those who have gotten the vaccine. We need data transparently provided to the public to know that, but this is my understanding. But even more alarmingly, people of color who, again, we only have anecdotes, but it appears based on what we see that they are significantly underrepresented. I know you've been talking a lot about this tonight, but one of the reasons is the difficulty of getting an appointment. And it's become like the Hunger Games, and people who are vulnerable are getting crowded out. I will say that when it comes to where the vaccine is delivered, at the moment we have a short supply, so it's a little bit hard to talk about that, but it's not too soon to start thinking about expanding vaccination everywhere in the city, in NYCHA community centers, including here in CB7, in school gymnasiums, and finding a way to get to seniors who are, or anyone who is homebound, seniors and others who are homebound, because there's no solution for them today. And there are other states which have started going door to door You really couldn't do it with the Pfizer vaccine because the cold storage is too tough. But you can. There's other states doing it with the Moderna vaccine. We need a solution for people who are homebound. And Chairman Brown and I were chatting the other day about his interest, to his enormous credit, of really pushing for a NYCHA site or more than one in CB7, and I really applaud you for that. The need here is desperate, and I certainly would like to partner with you on that effort in any way I can. So I'm going to pause there. Happy to open it up for questions or comments if you have any.
Okay, thank you, Councilman, and thank you for all your work consistently throughout this crisis, pandemic crisis.
Thank you,
and
Shelley.
giving leadership in the council and the city, because we sure needed it.
Thank you.
We're going to go back to, next was Madge and then Rich. Madge, we don't hear you. You need to unmute.
Am I unmuted now?
Yeah, now you're fine.
Okay.
Great.
I was going to approach some of the things Mark Levine just spoke about, and that's getting simple sites up. About 2 weeks ago, you could get online and get an appointment, no problem. Of course, some of those were canceled. But now to find a simple site to make an appointment, especially for someone who's not well, cannot get out easily, is really difficult. And a lot of the sites that people mention are not really functioning properly. So it would be great to have just like 1 or 2 sites that are working.
There needs to be one. There needs to be exactly one place to do this. And
yeah,
look, I look at the UK with such envy. There's one site nationally through the National Health Service to make an appointment. Socialized medicine does have its advantages. We have a very fractured health system here that makes it tougher, but technology offers a solution. And I see we also have Pauline here, who's another amazing team member at the Department of Health. And I know that that they're working on this and that they care about this. You know, my job is to agitate. But
thank you for that.
And Chelsea and Pauline and other leaders in the health department, I think we definitely have allies in that fight. But the city could and should build something. I'm not saying it's trivial, but you know, we're going to be vaccinating in this city for a long time. You know, guys like me, my turn is not coming up. If I'm lucky, it's coming up this summer at the pace that we're going. And the process of getting all of us vaccinated, even if we get to herd immunity in the middle of this year, will stretch on certainly to the end of the calendar year. So let's invest now in building a system that for the duration of this crisis gives you an easy way to book an appointment. Yes, and also via phone as well. Forgive me for Madge. There's some people for whom technology is just not an option because they don't have a computer, they don't have internet, or there's other challenges. And so there doesn't need to be a way to access appointments by phone. Right now, you can do that for city, I think both the city hospital, public hospital, and health department sites. I'd like to see something that encompasses private sites as well, and it has enough operators or customer service reps to make sure the waits aren't too long. That's going to be key to diversifying who's able to get vaccinated.
Thank you.
Okay, Rich.
Yeah, thank you. And thank you to everyone. Your work is heroic. Really appreciate it. One thing I'm noticing as I'm listening to the presentations is just this paradox of, you know, we know there's a shortage, there's difficulty signing up. As Mark said, it could be summer until a lot of us are able to get the vaccine. At the same time, there's a real issue with vaccine hesitancy, and those people who are most important to vaccinate are not wanting to get vaccinated. And I'm wondering if there are ways of using the vaccine as itself as a way to build trust. And one thought is, can we reach out to influencers in those communities that are hardest to reach, even those under 65, and offer them early access to the vaccine if they'll help spread the word and spread trust? And even gamify it or have a contest where, you know, you can get access to the vaccine if you get 100 people to sign up. 100 elderly people, or you can get access to the vaccine if you help elderly people sign up to get the vaccine, or even if you bring homebound people in to get the vaccine, just as a way for people to, those people who can be most influential to help spread the word. And then a second question is, hearing Mark talk about the difficulties with sign up in the website. When healthcare.gov rolled out, we know there was this huge catastrophe with the rollout. A team of tech experts on a very rapid basis were able at a federal level to reinvent healthcare.gov 2.0. Is that something that should be done at a federal level? And is the Biden administration considering putting tech resources into vaccine signups?
They sure should be. I don't know the answer to that, but I mean, the lack of federal leadership in any aspect of vaccination other than the development of the vaccine has really hurt us. And we've just got no help on the distribution and administration of the vaccine. It's like Operation Warp Speed sort of forgot about that, and it's really hurt us. And the kind of project you just mentioned, Rich, is exactly what I think a good federal government would do. And I mentioned what they did in the UK, and boy, it would be amazing if they invested in that.
Let's make it happen.
Yeah, and
Other questions from?
Any thoughts on my first question about?
Yeah, I mean, I'll answer this. This is I think it's a great idea. I think the idea of unleashing creativity. I mean, Mark's mentioning the UK. The UK government even has a whole nudge unit, which uses behavioral economics to get people to make healthier decisions. We could take that same wherewithal and do that with the kind of creativity with local leaders and so forth. We've suggested some of these incentive pieces. Some big employers are actually offering 4 hours of pay to get vaccinated, just Dollar Generals, for example. Waffle House is doing stuff in the South. I mean, there's other places that you might not think would be the obvious ones, but I think the kind of creativity locally with the influencers that people will resonate with, I think is really key. And I think that was part of, if I'm not mistaken, what Chelsea was saying of how to foster this on the local level with that kind of creativity would be something that, again, we would support. And Mark, I'm a professor at CUNY School of Public Health, and I echo exactly, we were asked a question on the federal government's piece. And the only thing I would say is I don't know the person's name who has been brought in, but the same person who helped the Affordable Care Act initial crashing of the computer has been brought into this administration to, I think, hopefully help on the national scale. So we do have hopefully a credible and trustworthy and good federal government.
That's great to hear.
Yeah.
Okay. Any other board members' questions? Okay, Louisa? Please unmute.
Sorry. First, I want to thank everybody. The degree of information is fantastic. But the problem is that there is no single source. It's been mentioned a couple of times. They're going back to actually just getting the vaccine. Getting the vaccine is fine. Booking the vaccine is a horror. And I have gotten numerous tips from people in the last couple of weeks. You have to do this, you have to do that. That's ridiculous. There has to be a single place where people can go. There has to be telephone service that works, because at the moment, if people are using the phones, they're holding on for well over an hour. But what I'm very concerned about is that there is no central source of information. You were offering fantastic information. It is two kinds. It's how the vaccine works, the technical medical information, and there's the other information that people want to know what's going to happen. Like, you get the second vaccine. 3 weeks later, presumably, you are 95% immune. But what I've been hearing is that you still have to wear a mask, you still have to socially distance because you might be a carrier. This seems counterintuitive to me and to a lot of people that I've been speaking to who've been getting the same information. So I wonder if anyone could explain that. But you see, there's a lot of what is going to happen to me information that people really want to know. You know, how is the vaccine going to change my life? What can I do? Can I go to Trader Joe's? You get what I'm saying?
I can take first stab, and then, you know, much to the chagrin of my mother, I'm not a physician, so I may ask Dr. Watson to jump in here on kind of the science behind why we're not quite there on throwing our masks away just yet. I think, number one, your point about information is well taken and really important. I think I'm going to drop in the link to where all of our information is on the website, and I'm happy to take feedback on it. I think what people need to hear is exactly what you're saying. Why does this matter for me? It's my shot. You know, what will this do for me in the getting me back to where I was a year and a half ago, or at least not in the middle of last year, right? So I'm hoping that some of this information provides a little bit of clarity. We have some fact sheets. There's one for older New Yorkers. There's one on just kind of the basics of the COVID vaccine. And I know that not everyone wants to like pick up a government document, although we've tried to make them pretty, and take it and say like, look at this thing I have. But basically what I hope people are able to use them for is to read them and then help answer the questions of their family and friends, because you're the ones who people need to hear from, not me. It's like this personal touch of, I got the vaccine. This is why I got it. I'm going to tell you the story of why I did it. This is what I experienced, and this is what I can expect. So exactly what you're saying. It's my job to arm you with the information to do that.
Okay.
Okay, any other questions from board members? I have a question. TV ads. Okay, we learned from Dr. Ratson that TV and radio seems to be the greatest source. I still see the same type of ads about COVID that I was seeing 6 months ago. Okay, what I should do and be safe and so on and so forth. There doesn't seem to be any public advertisement about the vaccine and information about it, and some questions and answers about it. Public service announcements. Okay, I think there should be public service announcements in the cabs. Okay, if people are taking them, but certainly, and a little more maybe on the New York Link. I know that people don't have answers to those questions. They tend to turn to those who they trust or have some information that they know. But these things should be clear, okay? And documents are fine, and I think they're valuable. But I think the average person who's watching TV, if there was a commercial on, the fact of the hour on New York 1, okay, what we should know. Maybe someone can get things going there. I think that's where people get their information, and I think that we need to have it out there and clear.
Yeah, I'll start, and then happy to take others because I don't want to dominate the conversation. I think it's a great point. I love the fact of the hour. I may take that. That's really good. I'm hoping, I just got mine today, but we just did these direct mailers acknowledging that not everyone has TV and internet access, and some people really do need hard mail. So this Statue of Liberty in various formats is now going up on in subway stations and subways and transit. I believe the link kiosks are up soon if they're not there already. And we do have some ads in the works. So you should be seeing this NYC vaccine for all, safe, free, and easy in more places. But okay, news, got it.
Yeah.
I also dropped in the chat, the Commissioner of Health did a YouTube video in both English and in Spanish about vaccine information.
Yeah.
Thank you, Colleen. That's really great.
All I'll say is that we do teach this, we do develop these kind of pieces. And I often say it's not just message, but it's also dosage. So we have to get it everywhere. You were saying taxis, subways, outdoor, shelter, you name it. And we also need to test the messages that have visibility at the cultural level and language level. And there are ways to do it. All I would say is the youth anti-drug media campaign, it was very targeted, obviously, on the youth side, that we learned a lot of lessons, but we've even tried to say, can you come up with the next Smokey Bear icon? But it is possible. And I think Sheldon has a great piece to raise, and how that would be able to continue to diffuse its way through society. So it's known with a slogan or a jingle. I mean, there are other things that can work in this regard.
Okay. Gonna work on that tonight.
I have a very quick question that I want us to hand it over for community questions. 2 people have signed up, so I don't think it's necessary to keep time as far as time to speak. I just wanted to ask one question for the purposes of our role and responsibility. What is happening in terms of children and youth? Is there anything that we should be aware of in terms of vaccinations or health consequences, or work being done to protect children and youth? Is there anything we should be aware of?
Maybe I'll just take that, Catherine. I think you're asking what was a similar question before about why we don't say that the vaccine stops transmission. So the vaccine has emergency use authorization, and the only thing that it is, the endpoint had to do with the severity of disease. And it was not tested down to the childhood level. I think Israel is the only country now that started with age 16 and above. We also, I mean, before even COVID hit, the work I was doing at the Kennedy School was looking at the measles outbreaks that obviously also had hospitalizations in New York City that were unnecessary, in my opinion, from people not getting MMR vaccines. So I think we need to look at those all holistically. A lot of children have missed their routine vaccination because of access to services. So that's why we're using vaccine literacy broadly. Yes, we need to get a COVID vaccine, but right now it's not hesitancy is the issue. As Mark said, it's the supply that's the issue. Hesitancy will probably come in summertime when we get to 50%, to get from that 50 to 80% to protect everybody. So we should be thinking about childhood vaccine. We should already, before you know it, be thinking about seasonal flu vaccine that will be available in the fall. And we can think differently. I mean, Commonwealth of Massachusetts is the only state where both teenagers and up through college age students had to have a flu vaccine to go back to register. Now, we haven't looked at the data yet. Is that making a difference on their COVID response? But these are the kind of pieces that we can think about. And I think you're asking the right question. We should not forget the childhood vaccination schedule, and we need to get that message straight.
Okay. So I can't see the 2 names. If someone can cue me in.
Rosa can take this part of the discussion. Rosa has asked.
The first person is, hold on, it's Maria D'Angelo. Do I have to?
Give me 1 second, I'll promote her.
Okay.
Hi, good evening. Am I live?
Maria.
Hi. So my name is Maria D'Angelo, and I'm a candidate.
Maria, you're on mute.
Sorry about that. Hi, my name is Maria D'Angelo. I'm a candidate for District 6 City Council. We were just approved about 10 days ago by Campaign Finance Board. So we're very excited to be participating in the City Council race. Thank you very much for all these great presentations. I'd love it if we could get to the point where access. We need to convince people to get the vaccine, that getting the vaccine is something they should do. And I love all these initiatives to do that. It's so important. However, I think there's a reality here, and Council Member Levine has pointed out very, thoroughly the significant problem we're having with the fact that there's inadequate supply, and New York City is not getting its fair share of vaccines. The Upper West Side is not getting its fair share of vaccines. I really don't know anybody who's been able to get a vaccine except for frontline workers and other, healthcare workers, and that seems to have gone fairly well. But our seniors aren't getting it. People living in congregate shelters aren't getting it. People in our NYCHA housing aren't getting it. And as everybody's pointed out, there's a real breakdown. So we all know there's a problem. There is a problem. And so what I would like to ask of the community board and Council Member Levine is, what can we do to open up the spigot here? If we're not getting our fair share of vaccines, do we need to, engage in some community activism? Do we need to do some lobbying? Do we need to get people on a bus? What do we need to do? Go to Washington to open the spigots and get our fair share of vaccines? We shouldn't be experiencing this. Complete, we're in phase 2. We can't open our city. It's a tremendous, impact on our economy not to be able to get our, residents vaccinated. And so I really want to, with extreme urgency, ask, what is it that we, the community, can be doing? Those of us who are in the community, what is it we can be doing to advocate for more vaccines as quickly as possible so we can get going here? And this whole, computer, the tech issue is huge for people who don't have. I have many, many friends who, have complained to me about the fact they're not tech savvy and they can't run 5 computers and telephones at once to try to get on. So we've got a real problem here. It's really significant and it's getting worse. And I know I'm speaking to the converted right now. I think everybody is expressing the same thing. So really my question is, what can we do? What can we do as a community? Are there any concrete steps we can take to try to do this? And is there anything, our group, the people I'm, working with who are supporting my campaign, what else can we be doing right now to open this up? Thank you.
Okay. I want to give you one response, and I think it's something that should come out of this meeting in a resolution, that there's no one in charge in the city.
Yep.
Okay, we need a single person and an office that's going to be responsible, has all the information that can deal with the chain of distribution. We don't have information on a day-to-day basis. It varies, it's contradictory. To actually get more doses, the president said that he would try to get 1.5 million a day as a goal. But I think we have to have a system in place that'll distribute it in a way that's more equitable and reaches those who are not being reached no matter what we get. But I think we should all be lobbying for both the mayor to set up this czar, as we had a czar for food insecurity. We should have a czar for a COVID vaccine, and have a system of distribution that's transparent, that people know what's going on, where we can find out where the vaccines are, when they're there, how to get them, and if there's something going, where the distribution works well, where it doesn't work well, what to do to help those areas that and places that don't do it effectively, get the vaccine to where it needs to go, on a more equitable basis. There's a Wadley, which is the only secondary school in Harlem, which our local school board kept open and redid. should be a place where most of the people be people of color who are coming. But I know people have gone there and said 2/3 of the people are not people of color. Now, it's good that anybody gets the vaccine, but you would think even if you put the site in a place which is 90+% people of color, that they would be the predominant group. So there's a lot wrong, and unless it's done with more voices that are not being heard, with more perspectives that are not being heard, and coordinated centrally, even if we do lobby and get as many doses as possible, the situation might not improve that much, I'm afraid.
I really
you-
hope we can try
Mark?
to
I was
improve
just
it.
going to comment
Yeah.
on that last critical point you mentioned, Shelley, about people from other neighborhoods willing to travel anywhere. People want a vaccine, they're going to go. They're going to go to the Bronx or Queens or whatever.
Yeah.
And this was most dramatically seen at New York Presbyterian, which opened up a huge site at the Armory. It might be the biggest site in the city. I don't know. They have 72 vaccine stations. They're doing like 2,400 a day. And it's been overwhelmingly white, which is just a huge, huge problem, which has to be addressed. But they're doing something which I think could be a good model, which is they've developed direct connects to a whole network of senior centers in Washington Heights, and particularly churches in Harlem and some other institutions who themselves kind of have the ability to bring constituents in to the appointment system. And that's the kind of like deep integration with community groups that I think we need to reach marginalized communities. And it seems to be helping some at the Armory. It's early, but we're going to need to do stuff like that citywide. It's never going to be enough just to promote this. We're going to have deep engagement with CBOs. And it's what we did on the census. Census spent $40 million to hire CBOs. You couldn't go to a tenants association meeting in Uptown Manhattan without someone bringing up the census for a couple of months there. And we need that level of buy-in from local leaders, community groups, to help solve the equity problem in vaccination.
Okay, thank you. Okay, our other speaker,
Hi.
Melissa?
Yeah, so I have a few questions. My name is
Please
Megan
identify yourself.
Excuse me?
Please identify yourself.
I was just about to.
Okay.
Sorry. So my name is Megan Martin. I'm obviously an Upper West Side resident. I'm also a board certified anesthesiologist with a master's in public health. So I am one of the lucky few, I guess, that have had the vaccine. So I do want to address that first comment that you just made, Shelley and Mark as well. The only two vaccination sites that were open by the New York City one was in Harlem and one was in Tribeca. So that was the only opportunity, I'm sorry, not in New York City, in Manhattan, for where 1A eligible healthcare workers or frontline essential workers were able to go and get their vaccinations. And so if you are identifying various races, ethnicities, et cetera, going to that facility, that was because that's where the mayor or whoever makes those decisions open that facility. I mean, if it was open on the Upper East Side or the Upper West Side, that would have been much more convenient for me to go. That's because I live closer to there, but frankly, that wasn't an option. So I think that maybe, we should just understand certain limitations on where vaccination sites are. So I just want to kind of narrow the question about supply, and maybe Dr. Ratson could also weigh in on this. Obviously, supply is the biggest problem we're all facing right now. You mentioned, Mark, that we have 7,700 doses in New York City right now. Dr. de Blasio says we're about to get 100,000 doses. The numbers just don't add up. That the reason we're having some kind of discrepancies because of outside residents coming into New York City utilizing them. So who exactly is the supply chain? where we have the pharmaceutical company, we have the federal government, we have the distributor, we have someone from the New York State, New York City. So when the mayor's office understands how many doses are being distributed to New York City, there's multiple people that are in that process in order to say, accepting that number and know that there's a number of doses that are at the top of the chain and then are ending up at the bottom of where we are. So I think that that's kind of confusing to the public and creating a little bit of vaccine hysteria, I guess. We only have 7,700 left. We only are getting 100,000 left. We're not going to be able to reach herd immunity until 2022. So I think that that's kind of a really big problem, because if we don't understand where the supply is, whether or not we're going to have adequate supply from the different pharmaceutical companies in order to even reach the communities by the summer, then, you know, how can anyone even sort of prepare themselves to accept a vaccine, prepare? I mean, I have 2 small children, job, families. There's so many different situations that are really being disrupted here. The other thing I just wanted to kind of bring up that I haven't heard is the idea of mandatory vaccinations. It's not a new concept. We all have to do mandatory vaccinations when we go to other countries. If you want to go to South America, you need a yellow fever vaccine. If you want to go to Southeast Asia, you need typhoid, hepatitis. So is there any appetite, I guess, for the idea of a mandatory vaccination? Because this obviously is not just a public health issue. This is one of the probably the largest scale economic crisis that globally we're facing. So,
Dr. Martin, let me just quickly respond to both of them and to thank you for what you're undoubtedly doing for healthcare in this city. I love MD and PHs. 2 degrees I don't have, but thank you. Look, I absolutely stand by sounding the alarm on the desperate shortage of vaccines in New York City, because we need the federal government to give us more. And I'll say that I think in part thanks to the collective primal scream of local governments around the country over the last few days, the Biden administration announced just in the last couple of hours that they're going to increase the local allocation by 16%. Now that's not near enough, but probably need a 300 or 400% increase, but within the parameters of that in which they're working, just 7 days into the new administration, it's something. Just to clarify, New York City gets its own direct allocation from the CDC, from the federal government. We're very special that way. Most other jurisdictions, it only goes through the state. So the state gets another 250,000 or so weekly. We get about 100,000. And to say that at that level, we won't get to herd immunity till 2022, I mean, that's just simple math. We got 8.5 million people here. You want to get 6 or 7 million of them vaccinated. That's 60 or 70 weeks at this pace. So I think we have to say that we're on an unacceptable track for sure. As for the mandatory piece, I certainly for now would not support it. I mean, I don't think you can even legally mandate something that's only an emergency use authorization. Secondly, I don't see how you can legally mandate something where there's a shortage of that, because then that's really not fair. But I think we're so far away from being able to offer everyone who wants a vaccine that opportunity that I think we just need to focus on that right now and increase demand through all the kind of education and outreach that we've spoken about. I mean, there may be a world in which some employers require it, maybe in the healthcare setting.
They already are. My employer's requiring it. So, I think that's a reality, frankly.
So maybe offline, you'll tell me who your employer is if you don't want to. I mean, I'd heard.
Yeah, and it's a private group, but I think if you expect your physicians to, provide you a safe environment, I mean, especially in surgery, this is the world we're going to be encountering, right? Like, we have to have our patients be tested X number of days. I'm sorry, I'm sitting in the dark because my daughter's sleeping in the next room. So excuse the surrounding, but I mean, we're in very uncertain times right now. And so, I mean, frankly, I think it's the right decision. And, we can sort of extrapolate that moving outside of the healthcare setting.
I just want to point out to everyone that it's almost 9, and we do have to be mindful of time. I know that Shelley wants to share a resolution that he's put together, and we also have to provide opportunity to discuss any new business. Scott, I'll hand it back to you so you can make your comment. I didn't mean to interrupt you.
No, Catherine. And it was just going to be very quick to address the issue that 2 of the people that are on our advisory group, Larry Gostin at Georgetown and Heidi Larson, just wrote an article in the Journal of the American Medical Association, specifically on the mandates. And yes, it could be a condition of work for some, but as Mark rightly said, the emergency youth authorization puts a lot off the table. There are other things to deal with until we get to that. And we have not found any group that would say that would be the solution at this juncture. Lots to do. I think there's been great dialogue tonight, and anything we can do to keep, helping push the right, best information, evidence-based approaches and work together in partnership here. So thank you. I'm going to be quiet and hope to get the rest of your business.
Thank you.
Thanks.
Madge, you need to unmute.
May I ask for the doctor's last name for the minutes? I couldn't get it.
Oh, Martin. It's
Martin. Okay, thank you.
I will just actually say the last thing is that the training, for physicians or healthcare providers to give the vaccines, it's a mandatory 12 hours that you have to be at these facilities, and that's a little prohibitive to many people. Among some groups with other physician moms. And so that may be just something to reconsider. I don't know who makes those decisions, but 8 hours would be easier if you want to have more volunteers.
Okay, thank you. I'm going to present a resolution that I've composed, and it's subject.
Shelley,
yes.
Shelley, I'm so sorry to interrupt you, but Megan, can you just clarify that for me? You're saying that, can you just clarify the context for that? Because I think it's really important to encourage peers.
Sure, yeah, so through the health and, the what is it? Health and hospitals, you can volunteer to become to vaccinate individuals and to volunteer as part of the workforce. But it's a 12-hour shift, and it's prohibitive. I have 2 young children. It's difficult with childcare, and so it's in discussions with other physician moms. But I think that in order to get more volunteers, it would be to make the shifts 8 hours would be better to advocate for more people to come on.
Okay, thank you so much for clarifying that.
Sure.
Okay, so I'm not going to read the entire thing, but most of it, and hopefully we'll be able to come to an agreement. So this resolution is on vaccine distribution, access, and equity, and the resolution is based on the following information and facts. There's widespread concern about the apparent lack of planning and the chaotic and inequitable system of vaccine distribution. 2, at present, there is no single official or office who can determine the vaccination strategy in each zip code, particularly those hardest hit with COVID. 3, there are access issues for seniors and persons with disabilities, including use of technology and accessibility to vaccine distribution sites. 4, there is no plan to vaccinate homebound people. 5, the scheduling system has been problematic due to the system crashes, difficulties in navigating various portals, disparities in information access, and a lack of central coordination of scheduling. 6, access to information has been inadequate among certain essential employees working in the home health care agencies and supermarket chains, particularly information about how and where to get vaccinated with their workforces. 7, seniors and people of color are underrepresented in the number of people being vaccinated. 8, at the beginning of vaccine distribution in New York City, there was no plan for vaccinating NYCHA residents. At present, there is no plan for Douglas houses or Amsterdam houses in our district. By the way, there are, I think, 6 housing developers, NYCHA developers in the city where they have a plan that's being implemented now, but not in our area. 9, there is not at present an adequate supply chain management task force to track and redistribute vaccine supplies in real time away from sites that are struggling with vaccine delivery to higher performing sites, as well as provide capacity building and technical assistance to lower performing sites to increase the vaccination performance. We didn't say that specifically, but the governor had been speaking about sending it to higher performing sites, but the piece that was missing is what do you do about the other sites? And so I thought that would be something we can consider. Research is 10. Research is from CUNY Graduate School of Public Health and Health Policy, CUNY, SPH, and Emerson College. And I go into talking about the tracking surveys. I go into talking about the work of Convince and the work of the test and trace group and what they're doing, which you heard tonight. I don't want to read another page. Also, particularly Convince, the Global COVID-19 Workplace Challenge, which they outlined, which is a draft in which private and public organizations will have to respond in their dealing with their employees to certain issues and pledge to do it. So I'm going to come to the resolution. Therefore, be it resolved that we urge the mayor to assign a single point person with the staff who can determine the vaccination strategy in each zip code, especially those hardest hit by COVID-19. That person should oversee the development of mechanisms for outreach, tasks for let's see, and how to schedule, and scheduling of appointments. Let's see. We call on our community leaders to support the outreach efforts of the Test and Trace Corps to reach the particularly NYCHA developments in our district, and to restaurant workers and others, and to provide them with the proper PPE. We're addressing the, we ask also the elected officials and community leaders to address the issues of access in many ways through the possible mobile units for the homebound, tracking data by age, disability, ethnicity, and do it with with the idea on fairness. I don't have all the words down. Let's see, have more diverse voices and perspectives in the management and leadership of, in order to address the needs of different populations, as well as, I don't even have words, but trust me. Okay, we suggest a single website and for all the scheduling, and to call and have a call in with customer service, not just have one person on the other end and not have people waiting the hour. let's see, call on all elected officials to guarantee the equitable distribution of vaccine. And that'll be the number one thing. Furthermore, to urge all city agencies elected to support the work of Convince and and to promote the work of the Test and Trace Corps, and urge immediate focus on providing information and access to communities of color, NYCHA buildings, essential workers, seniors, and the disabled. Let me just see if there's anything else. I think that's it. Okay, I hope I covered everything. We're certainly open to additional suggestions.
May I make a suggestion?
Sure.
That was so comprehensive. Shelley has the ability to take notes during meetings and then just reproduce like almost everything that was said. I could never do that. So what I would like to suggest, because there were so many great ideas during this meeting that were shared, and we have so many different sources, is if we could take that text and I can turn it into a Google Doc so we can all see it and add to it there. Is that something that we could do? And maybe, so Mark and Steve can tell us about timing, but maybe we could get it done by this Friday. Would that be sufficient?
I know the goal. I think the tentative is yes. I mean, I got to double check with Penny. I think that should be fine. But I think I think we're trying to making a big push to get things up on the website in a proper timing. So let me follow up with you in the morning, but I would think that timing would work.
We'll do it.
Yeah, I just think we need like a few days. But we'll get it if we can get it sooner, great. I mean, we'll try.
And you indicate to Penny out of this meeting, because we're putting the schedule together, that we have a resolution coming out at HHR that'll each start the process.
Yeah. So we'll do it as quickly as possible. But Shelley, what do you think about that idea of like turning the typed text into a Google Doc so everybody can comment on it?
I think it's a good idea. I think people should suggest modifications or additions if I left things out that they felt were essential. But I think it has the essence of what.
Definitely.
Okay,
100%.
Robert, do you have a recommendation or a suggestion or question? Robert.
Yeah, I think certainly that it's important to get a resolution out, but I think we had a theme that from all of the sectors at this meeting, and one of the serious deficits in the city in planning this whole thing to begin with is that we don't have that office, we don't have the czar. And that I think that I would like to see the resolution focus on that. Now, the laundry list of items, these are all the functions of the czar and the partnerships with other departments in the city, Department of Health, Department of Education, CBOs, hospitals, and so on. But it's essentially what we're lacking is a poison. It's a poison.
It's a poison.
To take charge. And I think that's if we make that the thrust of our resolution and have other community boards sign on and so on, and rapidly, I think that we make the strong point, because all of the other items that you list, of course, are all correct, but they fall in to that portfolio. And so I'd like to see that focus in the resolution that we wind up with.
Okay.
And Shelley did put that first.
Yes, it was fun. And we didn't lose it. We lost it because it's just part of the bundle. And I think that it should be primary and prominent and loud.
Okay. And then I also just want to point out that idea came from Gail Brewer's office for the czar. And it's a really good idea.
Catherine, I just put my hand up quickly. I wasn't going to add, but I think Robert's spot on. And I think sometimes we want resolutions that are encompassing and have a lot of information, and sometimes simplicity is the answer. You know, I think we've all had a lot of meetings, and we've heard of different meetings, and there's been data, but I think that particular point, Shelley, is, and Catherine, is really the point. And sometimes if we make something super long, it kind of gets lost in it. So again, I'm just agreeing with Robert that that type of singular statement is very powerful. And I'm not saying you can't put other things, but I do think sometimes simplicity is powerful. And if there was one thing I would want what you asked. So, just something to consider. I just want to concur with Robert.
Good point. Doug?
Yeah, I understand, that the task force met today, and Borough President Brewer has a list of items that her office is deemed as a priority and is an ongoing. So I just want to make sure that all those great ideas and the ones that we support are going to be incorporated into any resolution that we are going to write. And
Yes, 100%.
Great. Anyone else? Courtney. Sure.
Hi, and so I totally agree. I think it's great to have it as an overarching, we need a czar, here are the other specifics. I actually want to seize on something else that was said, which is the idea of socializing this across other community boards. I think that's a great idea. I think this is something we could quickly get some people on board with. I think more voices quickly would help. And so anything we can do on that would be great. And I think is a wonderful idea, Robert.
I'd like to piggyback on what Courtney just said. So when this is brought to other community boards through the official process, it goes through Borough Board, and it can take a long time. So Mark and Steve, is there a way to share this with community boards faster so they can see the text of what we've written, or does it have to go through that formal process?
And Mark's happy to jump in, but it's my understanding, and based on my brief tenure, is that we develop one-on-one relationships with community boards. And I think, for instance, we could comfortable with Community Board 6 or another one, but there's no formal process to get out to the other 12. I know Mark had a working group going on before, and I would certainly be more than happy to have him add his thoughts and or ideas.
I'd be happy to work with 7 in Queens. I'm a very close colleague and friend, and we're collaborating on other things.
Thank you.
That's for one. Yeah.
Funny, Robert, because I'm on a board with the land use chair of 7 in Queens, so it's 7 in Queens and 7 in Manhattan, I guess.
Yeah.
Cynthia
Jeffers. Do you know Cynthia?
No, it's a man named Chuck Apian. Anyway, to pick up on Stephen's point, we do have an informal network of chairs and formal chairs, so we can share that way. I don't know if that will get it onto the agenda of Borough Board any faster, but it might generate some effort there. If I could take the floor for just another quick second to say that I appreciate the completeness of the resolution as it was read to us, but I might share Stephen's impression that it might be more effective if we cut to that chase. I have been very impressed with the work of the Test and Trace Corp and with the mayor's office. And those who know me know those aren't words that come naturally to me. But I've been impressed with the mayor's office work on this. And I did hear in Shelley's resolution commendation to our friends at HHC rather, I'm sorry, and CAU. And but I do agree with the overarching move, which is that there needs to be a czar. And if I were to offer a thought to Shelley about how to add to that, having a designated czar not only would be effective intra-New York City government in terms of marshaling resources once they are here, but it could create a single platform person who could be the point person with Washington and with Albany and perhaps with Trenton and Hartford. And one of the problems early on in COVID was that we were competing states against one another. And it was only our governors in the tri-state area that solved that problem by agreeing not to do it. But having a czar would be an effective tool to make sure that we have single source and single point of advocacy with a unified message. I'll shut up now.
Good.
And
Thank you.
that is actually, that's responding to an issue that was highlighted in the vaccine task force meeting this afternoon, which is poor communication between city and state. So if there was one person to communicate outward, I think that's a really good point. So
We have to have a vote.
I do have to follow up with the borough president's office about our previous resolutions, kind of going through the borough board process. So Mark, it sounds like that this would need to go through that process. So I can, once we have like, Courtney, once we have a resolution and it's passed through full board, then we can explore ways to distribute it. I do think that should be a priority as quickly as possible. But I think we'll have to go through borough board ultimately, it sounds like.
Well, yes, I mean, if you wanted to have a borough board vote, then the borough president's office is the one that controls that agenda.
Yeah.
Okay, so we need a vote on the resolution from the committee first. All in favor? 1, 2, 3, 4, 5, 6. Okay, 6, 7. I don't think there's anyone opposed, right? Because everyone voted 7-0-0-0-0-0. Non-committee board members. 1, 2, 3, 4 that I see. Okay. And any no's?
Kelly, it was 5.
5, even better. 5. And I don't see any no's. Abstentions? No. Okay, fine, great. Thank you. Good. So I think we want to, Catherine, talk about next month.
Oh, okay. So something very exciting happened, which is that in response to the resolution that we wrote on condemning hate crimes and kind of calling various offices in the city, especially including the borough president's office, the hate crimes unit for the district attorney's office, and the NYPD to kind of support the work that they're doing and call for more of it. Mark does what he always does, which is he prepares a letter and shares our resolutions with relevant city agencies and groups. So Mark helpfully shared it with the district attorney's office, and Cy Vance responded to Mark and said that the hate crimes unit was eager to work with us. So Shelley and Rosa and I and Mark and Steve met with that office, several people, and we talked about various things that we could do as far as what they provide is education to the community to prevent hate crimes, and also educate the community about what to do when those occur, when human rights violations occur. And so the next step is likely to, or that we're planning, and we'd love to get your thoughts, is to host a forum for the community. And it would we would really follow the direction on the hate crimes, people that work in the hate crimes unit and the district attorney's office for how to do it, because they do it all the time. It's like a major part of what they do. But we might also bring in, so we would defer to them on what that would look like. But we might also bring in the New York City Commission on Human Rights, because sometimes actions aren't necessarily hate crimes according to the legal criminal definition, but they are violations of human rights. There's another office that works to prevent hate crimes in the mayor's office. And then there's also the NYPD also has a hate crimes division. So we thought we might also bring those people, those groups and agencies into the conversation. And down the road, perhaps as a second step, we might reach out to the CEC and local schools because the hate crimes unit at the district attorney's office might also be able to work with local schools. So that's really exciting, because something that we did got this very enthusiastic response So that would occur in February, and we're just confirming that the date will work for them. So does anybody have any thoughts about, is there anything that people at the meeting want to add? Rosa or Shelley, Mark?
I want to just elaborate on why having all those together, because things that don't fall into one may fall into the other and people get confused. Someone said they were assaulted verbally on the street and they called the police and no one came. Okay. And they followed up and they felt it was a hate crime. It was hate speech, not a hate crime necessarily. And people don't know the difference. And so it fits, each situation fits into a different agency in a different way. And I think that clarity just doesn't exist among 90% of the people or more. So I think having them all there and hearing from each one will clear things up for a lot of people. I think it's be very valuable.
Right. That's very helpful clarification. We wanted to make sure to emphasize the point, just building off what Shelley said, that if something isn't a hate crime, that doesn't mean it's not a human rights violation. It doesn't mean that it shouldn't be reported. It doesn't mean that there shouldn't be some sort of action. Rosa, do you want to add anything?
It was a great meeting. I really enjoyed it.
What did you enjoy about it?
I was able to just speak up in a way that we don't normally get to during our meetings and voice some concerns.
So maybe an important emphasis for this forum is to, and I think that this group can help us with that, is to figure out how to provide space for that to happen in a safe way.
Good idea.
Great. And it may be, I think we're going to have that space for people to ask questions and to know that it's safe to ask questions. Okay. So, any other thoughts for the evening? If not, is there a motion to adjourn?
And is there any new business?
Okay. So have a good night. Everyone stay safe, stay healthy. Look out for the Google Doc. If you want to add something, modify something, emphasize something, so we can get it done and have it into the office so that they can distribute it in a timely way.
Great meeting, guys.
Okay, have a good night. Thank you all.